So, hi, my name is Calissa, and my project or research is on maternal factors correlates to toddler obesity. So, what is obesity? Well, it is defined as a abnormal or excessive fat accumulation that presents a risk to health. And during my research, I have seen that between the year 2017 and 2020, obesity prevalence was at a high of 41%. And it leads into other health problems such as high blood pressure, diabetes 2, coronary heart disease, stroke, and it could lead to death. Here are some of the causes of obesity, such as lack of diet, exercise, health conditions, medication that can cause obesity, stress factors such as school, work, money wise, and depression. Health risks associated with obesity. As mentioned before, it can lead up to health problems, like I mentioned, like high blood pressure, type 2 diabetes. These are just some of many conditions that can associate with obesity. We're going to talk about what has caused toddler obesity. According to CDC, 12.7% of 2 to 5 year olds in America from the years 2017 to 2020 were considered obese. What is considered an obese toddler, you say? Well, looking at like a BMI range, anything over that specific weight at that specific age range is considered overweight or obese. Possible causes? Well, I think that it comes from maternal factors and also has to do with genetics. Looking more into it, this is a possible factors research study that I'm proposing. But here are some of the factors that might take a toll on toddler obesity, which is diet of the pregnant mother, genetics, like I said before, and research shows that diabetes too of the pregnant mother might cause toddler obesity or increase the risk of it. So I'm proposing a 3 cohort study that takes place with 100,000 healthy pregnant women, except for one group, which is diagnosed with diabetes 2, starting in their second trimester. Requirements includes ages 18 to 38, healthy condition, except for that one group that includes all races and regular checkups throughout their pregnancy. This would go on for about 6 years to kind of keep track of when the child is a fetus to 6 years old and to kind of see what the weight is going throughout the years. According to the NI Direct Gov, the research shows that the diet of a pregnant mom can affect the health of a baby so much it can lead all the way up to adulthood. For example, when there's a pregnant woman, they're told to stay away from things like caffeine because it can increase risk of problems during the pregnancy. Also, overeating during pregnancy includes chances of bigger babies. A pregnant woman can be healthy, however, genes and genetics play a huge role on the development of humans, no matter how healthy you are. Some children are at a higher risk of obesity due to genetic factors they have inherited from their parents, and sometimes they're able to gain weight more easily. For example, have you ever seen somebody that is Samoan? They are generally more big boned people, but we see that it's just a genetic thing. It's not that they're not healthy, it's more of their genes and what race and their background it comes from. It has nothing to do with their diet at all. According to CDC, if a pregnant woman with diabetes is not controlled, it can cause the baby's blood sugar to be high, which can cause a huge problem. Diabetes too can cause the baby to be overfed sometimes and causing that baby to grow bigger than what it's supposed to be during the pregnancy. Overall, this can be an ongoing problem from the second trimester and up to delivery.
So the topic that I chose is specifically sickle cell and why are African Americans affected the most? Just to start off, just a question for yourself to ask: have you ever heard of sickle cell? And if so, what race or ethnicity have you seen affected with sickle cell disease the most? So just a brief introduction of it. So basically, sickle cell disease is basically an inherited disorder that affects your red blood cells. Normal red blood cells, they are soft and round, as you see right here on the left. And then people who have sickle cell disease, their red blood cells are more sickle shaped like this. They become hard and sticky as well. So with our red blood cells, we have hemoglobin inside of it that basically carries oxygen throughout the body. People with sickle cell disease, they have abnormal hemoglobin. With that, this causes the red blood cells to become sickle shaped and hard and sticky, like I said before. So when the red blood cells try to pass through the blood vessels, they become stuck because they're sticky and hard. So it's not a smooth transition for them. And this is what causes people with sickle cell disease to experience the pain that they have. Like a lot of people who experience the pain, they have to be hospitalized because of it. And this is all because of an HBB gene mutation. There are also different types of sickle cell disease. So basically, the HBSS is when both of the parents have the hemoglobin S gene. So in order for a person to have sickle cell disease, both of the parents, mom, father, they have to have the sickle cell gene. There's also one where one parent has the gene, but the other parent, they have not necessarily the sickle cell gene, but they have an abnormal hemoglobin. So this is kind of like sickle cell trait kind of. People who have sickle cell trait, they don't necessarily experience all the symptoms that people with sickle cell disease have. They usually don't experience any symptoms at all. And if they do, it's more of a milder case. So let's talk more about African Americans and sickle cell disease. As I was doing my research, I found that sickle cell disease actually traces back to malaria in sub-Saharan places in Africa. In the United States, African Americans are most common to have sickle cell disease. And people who have hemophilia, cystic fibrosis, and other these health disorders, they have a lot of like treatment centers nationwide, and they have like a lot of teams and research as compared to people who have sickle cell disease is really scarce, especially in low-income areas and rural communities. And I was also looking at the National Library of Medicine, and they took a survey of 30 pediatric sickle cell disease centers, and they found that only 18 of 30 of those centers transition their patients to hematologists. 60% of people with sickle cell disease, they use Medicare or Medicaid. They don't necessarily have access to specialized care because their insurance won't cover it. And also a 2014 the National Library of Medicine, they recommend opioids for the pain that they experience. And research showed that sickle cell disease patients are stigmatized when they seek pain relief because of the opioid abuse that is within our communities. Also, sickle cell disease research is not funded as much. I actually have a friend who has sickle cell disease. A lot of times she can't really get the care that she needs because of her insurance. To see that a lot of the research is not funded as much, I do kind of want to raise awareness for that as well. So my last point is racial biases in pain assessments. I'm not sure if you guys have heard the theory that Black people can't really feel pain. I've heard that a lot growing up, but I never really did my research on it. So I decided to see like where did that theory come from, or is this just something that people are just saying? What I found was a little bit different than like Black people not feeling pain. It was more so Black people have thicker skin than white people. And because of this biological difference, Black people's pain were being rated lower and receiving less treatments. So basically, I just wanted to touch bases on the lack of access that most people who have sickle cell disease have, and what we can do to improve it.
So I just want to talk to y'all a little bit about the overall workings of viruses and what they are and how they infect us more specifically. So the general overview of viruses is that one, they're non-cellular agents, meaning they're non-living. They're not what we classify life due to number four, they can't replicate independently but outside of a host cell. More topics on viruses is that they lack nucleuses, organelles, and cytoplasm, just genetic materials, so DNA and RNA. So they're very, very simple in structure. And then viruses are also extremely, extremely small, so we can only see them with what we call an electron microscope. And so here I wanted to go over some nomenclature on some viruses. So first we have a virion, which virions are more viruses that attack animal cells, such as like your cells and dog cells and stuff like that. Virions have capsids, which are protein coats that like a shield around the nucleic acid, and the nucleic acid itself, so DNA and RNA. And there's two different types of virions. We have enveloped and naked. So enveloped are the same things as just capsid, nucleic acid, with one additional thing of a lipid bilayer. The lipid bilayer that it is taken from the lipid bilayer of eukaryotic cells. So all of our cells have these lipids with fatty acid tails and hydrophilic heads, and so therefore it just takes a bit part of the animal cell that it infects. And then the naked is without the lipid bilayer. There's also bacteriophage viruses, which only infect bacteria, and they're usually seen in this complex form, maybe a virus you've seen before. It has this head part and then a sheath and some legs to attach onto. I wanted to go over into more bacteriophages and how they infect. They have two different ways they infect bacteria. So we have the lytic cycle. And the lytic cycle is basically just meaning that once the virus infects the bacteria, it will end up causing the bacteria's death. And lysis, lytic, it means bursting of the cell. So that's eventually how it will kill the bacteria. It will burst open its cell wall. So there's 5 stages I want to go through with the lytic cycle. The first is attachment, and this is where we can see up here in the picture that the virus sits down at the top of the cell wall, and it will start injecting its nucleic acid into the cell. So that would also go into stage 2 of penetration. So therefore, now that it's like pushing its DNA or RNA into the cell, into the cytoplasm, stuff like that. And then biosynthesis is around a third step here, where once that DNA has come into the cell, it basically, that DNA starts getting like read through, what we call transcribed, and therefore the bacteria will start now manufacturing all the parts of that previous bacteriophage that infected it. And then that gets to the maturation phase, where all those parts that were being assembled from that DNA are now being put together. And this is all inside this bacteria. And then finally, we have the release stage, where this is where, basically think of it as a balloon, where it gets so jumbled up with all those viruses that are being assembled, and it will burst open, and then those viruses can now exit out to the environment and infect more bacteria. And so finally we have the lysogenic cycle. Lysogenic cycle only has 2 stages. The first one is integration. Kind of think of it as the same way as penetration with the lytic cycle. The virus will attach onto the cell wall and push its nucleic acid into the bacteria. With the lytic cycle, it starts breaking up the DNA and assembling, using the factories to assemble their parts. But the lysogenic cycle, it will actually, the viral DNA will incorporate into the bacterial DNA. And this is what we call a prophage, which means that it's just the recombination of both those nucleic acids. And then actually the only last step to that cycle is the exit. So where once it will usually stay dormant with that viral and bacterial DNA put together until it deems necessary to actually enter the lytic cycle, where it will start breaking apart and then using those factories to make a virus.